In Oklahoma, over 20% of our adults and over 11% of our children live without health insurance. In South Central Oklahoma, nearly 17% of our residents live below the poverty level. These numbers work together to form a staggering number of Oklahomans who do not have the resources for even the most basic medical, dental, and optical care. All this in a state that is ranked 46th in the nation in overall health. While the problem is vast, the Good Shepherd Community Clinic was created to fill the void for those who lack access to the health care they need. From its beginning in 1995, the Good Shepherd Community Clinic has stayed true to its mission of providing free primary medical, dental, and optical care to the indigent, uninsured, and working poor of South Central Oklahoma. Starting in a small rental home and run purely by volunteer medical administrative staff, the clinic immediately faced a huge demand for its services. It was soon clear that the need for more services was great. In addition to volunteer medical professionals, the clinic grew to employ physician assistants, nurse practitioners, medical assistants, bilingual staff members, and a social worker. The clinic moved to its current home in 2010 and was able to significantly increase the number of people it serves. The clinic now includes primary medical care, dental care with a denture program, optical care, a pharmacy, a diabetic care program, a mammography program, mental health assessments with referrals, and a social service assistance program. The Good Shepherd Community Clinic also coordinates with area specialists who provide free consultations and treatment for referred patients.
My older sister found out that she was diabetic, and she called me one day and told me, there's a history of diabetes in our family, and I just found out that I'm diabetic, and you really need to go get tested. The lab work, the medication, all of it was very expensive. I couldn't afford the medication, and a lot of times I was doing without it. I came to the Good Shepherd Clinic, and the ladies here, they're very helpful. If it wasn't for the Good Shepherd Clinic, I would be very sick.
With Good Shepherd Community Clinic, I have been providing Spanish translation interpreting services for the Hispanic community. They come in more confident and more willing to share their problems or their concerns, their medical concerns, with me and the doctor on staff, since they can actually speak with someone that understands them. With them coming here to receive the services, a lot of them are getting the treatment that they have long desired and have long needed.
My life has changed tremendously since I found Good Shepherd. I didn't always have all my medicine I needed to make it through the day, through the month. They always have my meds, and I'm able to function, and thank God for these people, and God bless them.
Without a job, I had no insurance, had nowhere to go. I was suffering from high blood pressure, needed some care. If it wasn't for the clinic, I would have had to go to the hospital and probably the emergency room to get treatment for my blood pressure. They worked with me, and where I could get the blood pressure down, get a physical, and get me another good job. And then I moved on and got me a physician, and it's wonderful.
When I became ill, a friend of mine told me about Good Shepherd, and we really have appreciated their help. The quality of care is excellent here. They have taken real good care of us.
Without the services of the Good Shepherd Community Clinic, many would use the emergency room for their primary care needs or would not have their health care needs met at all. Chronic illnesses such as diabetes would cause long-term irreparable damage to patients who could maintain their quality of life if properly cared for. Breast cancer would go undetected until progressing to a final stage. Tooth decay would rob the patients of their smiles, limit their employability, and endanger their overall physical health. Poor vision would limit sufferers' ability to read, work, and drive safely. Conditions easily treated with pharmaceuticals would progress to complicated and dangerous stages. Because of the Good Shepherd Community Clinic and the donations and grants that fund it, the people of South Central Oklahoma have access to the medical, dental, and optical services they need for free or a minimal donation. Not only has the clinic saved millions of dollars in medical care for its patients every year, it has improved the quality and length of their lives. Patients are able to work, enjoy their families, and have improved their quality of life.